and the fundraising firm. Thank you for coming on to our webinar series, Infection Prevention and Control, number 4. And this webinar series came out of the desire to meet our fellow.
Sorry, Heather, you're muted.
Oh, I am so sorry. Hello, my fellow nurses. Let me just say thank you for coming on to our webinar, Infection and Control webinar series number 4. This webinar series came out of the desire to meet our nurses' demand of having their real licensure for infection prevention and control. And of course, we give you 5 sessions or 5 hours of non-nursing. So it's all about you. It's all about meeting your demand, meeting your desire to relicense, and it's all about us feeling good that we are able to meet you in what you need as a professional nurse. Now, I'm not the moderator, so I just want to greet you warmly, and I will now hand over to our moderator for this session. Do have a pleasant evening.
Hello, everyone. I am Katia and Thomas Elborn, and I will be your moderator for this afternoon. I am from Trinidad and Tobago, and being a member of Omega Kappa, this is one of their webinar series that is important for meeting the continuous professional development of our membership. And as such, I want to welcome you all for taking the time out to come here and update your practices, or for those who are probably new, to get an insight into what Omega Kappa has to offer. Now, with our webinar series, we always have a bit of a surprise for you in terms of how we do little activities, which is handled by our president, Ms. Cheryl Gariquez Lloyd. And at this point in time, I will hand over to her to conduct this activity before we continue.
Thank you so much, Madam Kathy. Thank you, thank you. Thank you to you and Heather. Good afternoon, everybody, and welcome again. Having said that, my name is Cheryl, and if you're joining us for the first time, we thank you for joining, as Heather said. If you've come back because you liked our first 3 webinar series, thank you, and we apologize that we were a little late with this one, should have been from November. So because if you don't know, you don't know, we're going to let you know. We always try to have an activity that persons are able to join us so that they're able to get their feet and their minds going before we get to our presenters. Usually we have 2, sometimes we have 1. Today we have 1, but there'll be a little bit of activity for you to complete before you get to hear our presentation today. So if everybody has joined from their computers, what we're going to do is we're going to ask you to pay attention because we're going to have a session for you to do a little bit of activity. You know, like when you go to school and you have a little quiz. So there will be some questions afterwards that I'm going to ask, but this activity in particular now is going to be something I expect you to participate in. I'm going to ask you to bear with me as we utilize the technology because I'm going to have to share my screen in order for you to get to the activity. So I'm just saying our sessions are infection prevention and control. And we said, why not just give you a little bit of non-nursing at the same time? But that was the main focus initially, infection prevention and control. So we want to find out, what do you really know or remember about infection prevention and control? And the point of this is it's epidemiology. So I can hear the groans already. Some people saying, Lord Jesus, and they haven't been to school in a minute, right? but you will still do well. So I'm going to ask you to prepare yourselves, and we are going to try and do a little quiz. If my computer would cooperate with me just now. All right. So let me see if I can make sure I have it. We're going to use a place called Quizzes, and it's going to tell you how you're able to get in. I'm going to open it. It comes with a code you have to put in and a link. So I'm going to get the link so I can put it in the chat for you to access it. And it's only 15 questions. And so we should be able to see when somebody is going to win, because it comes with a little bit of a prize, you know. So just prepare your minds. And I have to tell you from now, as educators, some of us in here, you know that thing that they told us about, if you're not sure, just pick C. Yeah, it doesn't really work. It's not true. I'm just telling you. All right. So I won't tell you to just guess, see if you don't know. And I know it may be a challenge because you haven't looked at this for a while, but just get your brains ready because you're going to participate in the quiz. You're going to see what you kind of have an idea about epidemiology. And then we are going to be able to talk about that afterwards. So I'm just getting the link to put in here for you so that you are able to click on it, and then we will see you popping up on the screen. So just give me one quick second while that comes up. All right. So here we go. Let me share my screen so you can see it. All right. Is everybody seeing my screen yet? Feel free to open your microphones if you want, if you're seeing the screen.
Yes.
So when you see the screen come up, you have to go to joinmyquiz.com, and then you enter the code and it will show us that you are coming in before we actually start the quiz. All right. So go to joinmyquiz.com and enter the code you see on the screen, and then we will get the quiz started as you are popping in. All right, I hear some people popping in. Wonderful. All right, come on, let's go. Pet Gay, you're in. Wonderful. I hear some more pops. Let's go. We have about 30-something people in here. Let's see how you do today. Let me just put it out there because you know what? We keep forgetting to put it out there. The disclaimer, the people of Omega Kappa who are doing this session this afternoon, the moderator, the host, they're not eligible to get a prize if there's anything to win, but you can participate in the quiz. Mrs. Wong Reed, you could enter as well. I'm not sure if you qualify for the prize either. All right, I hear more popping. Good job. Let's go so we can get the quiz started. Joinmyquiz.com. Welcome to the persons who have just come in. And when you go to joinmyquiz.com, then you put the code in you can see on the screen, and we're gonna start our little game shortly. Waiting on a few more people to come in. Oh no, what just happened? All right, hold on, let's fix that. There you go. All right, we are up to about 11 people. Just another minute so we can get some more people to join the quiz. It's not going to be graded. It won't go on your transcript. It's just for fun. So come on. Joinmyquiz.com and put the code in. All right, keep going. We have about 40 more seconds, and then let's see if we can get the quiz started. All right, anybody else? Counting down, and we're gonna start. Joinmyquiz.com and enter the code, and let's get our quiz started in short order. Everybody ready? All right, you can still join afterwards. There you go. One more person came in. Anybody else? You're trying to get on, it's not working. Wonderful. Let's go. 30 more seconds and we're gonna start the quiz. I'm sure people are already trying to guess what's gonna come up. All right, we're counting down. Two more clicks and then we're ready. Who else is coming on? Joinmyquiz.com. And then we're gonna start it and see how you're doing with your epidemiology, because while we are able to help you to meet the requirements of getting the hours that you need, for instance, the whole point of our sessions is for us to learn and to apply. So we are ready to go. So I'm gonna start the quiz. Everybody's ready? Let's go. Seems my computer is moving slowly today. I got another click. All right, counting down. So that's the leaderboard. It's showing the people answering and it's counting down. Right? Competition is on. Right? Not doing badly. Let's go. All right. I see Ashley looking like she's going for it at the top. How is it going for those participating? For those of you who just joined or those who didn't join the quiz, This is a little activity we were doing before. They're at Join My Quiz, and it's about epidemiology. So what you're seeing on the screen are the participants competing with each other. And in the lead, we have Madam Ashley, Renee, and Sandra are both at 3,100. Somebody's coming up. There are only 15 questions. All right, how are we doing? Looked at the leaderboard. All right. Let me know when you've answered. Oh, we're at 13 questions. 2 more to go. Almost there, almost there. All right. If you're finished, you let us know. It says there are 2 more questions to go. All right. Madam Ashley, boy, 2 people put you out up the top here. People are still clicking. Keep going. All right. Competitive. Some people just getting warmed up. All right, we're almost finished. Good competition going on at the top. All right. 1 more minute and then we're done. Counting down. All right. So let's see who's won as she's fighting her way back. And we are going to be closing just now. Everybody done? All right. Let's see who our champions are. So it appears that we have Rona in third place. Are you still seeing my screen? Where did our prize winning information disappear to? All right, so there was a 45% accuracy. Class, you see that? We're gonna have to work on it. But you know what? We could do a pre and a post. We can send the link. 85%. So you can see from our board here. And for those of us who teach, sometimes this is a great way to get your class involved. Congratulations to our first, second, and third place winners. Thank you every single body who participated in the quiz. So now I'm going to ask the persons who participate to tell me what did they learn, remember, or get from doing this quiz just now. I'll take 3 people. And let me tell you from now, when you don't volunteer, I'm going to pick on you and you're going to be voluntold. Who's ready to start? Let me see the hands. Or go ahead and open your microphone. Andrea Thomas Bruce, I see your microphone is open. Are you going to share?
It was a good reminder of some of the things that we do on a daily basis, but because some of these things we don't usually utilize what we have learned actually, but because we don't utilize them all the time, sometimes we tend to forget. So it was a good reminder.
All right. Thank you. So, who is the next person? Come on, colleagues, let us talk up. There are several of us in here. Let's share. Some people didn't participate, so they didn't even know what the questions were like. How was the quiz for you? And if I had to grade you think you would have passed or not? So I should volunteer somebody because nobody wants to speak. All right. Sandra, you won. Let me hear from you. Madam Sandra, are you here? Renee, are you here? You were second place winner. Everybody's quiet. Anybody, are you hearing me? If you're hearing me, click the raise your hands on the reaction buttons, please and thanks.
Madam President?
Go right ahead, Madam Kimari.
Well, I was late in joining, so I was not able to participate, but I did learn something. I learned a new platform that I can use to engage my students. I'm a Kahoots fan, but now I see
Oh,
quizzes.
quizzes,
I'm going
yes.
I'm going to explore quizzes, so that's what I learned.
All right, wonderful. I see your hand, Andrea McPherson. Go right ahead. You're muted if you're talking to us. All right, one last person while we're waiting for Andrea McPherson to speak. And yes, quizzes is another platform to share. All right. Janelle, were you intending to share with us? We're hearing you. All right. So type it in the chat. I'm not sure what's happening with the unmute, but other persons have spoken. So, Janelle, Messam, are you speaking to us? We're hearing you. You wanted to share about the quiz?
No, I wasn't intending to speak. It was a mistake.
All right, that's okay. So we want to thank everybody for participating. This is how we usually start off with a little activity to engage our brains, to get us in the moment, to get us to understand. And so once again, I'm going to hand over to our moderator, Kathy Ann. We want to thank you again for joining, and we hope you have a wonderful time with us, whether you're here just for today or for all of our 6 sessions, because we've tried to ensure we found topical, current things, and that will excite you and you'll be able to take it back and apply it. Thank you, everybody. Over to you, Kathy Ann.
Thank you, Cheryl. So once again, we would also like to welcome our viewers on the YouTube channel as well, because it's not just on this platform, but we know we have persons also on our YouTube channel. So welcome to this session, this 4th webinar series on IPC. And just to note to the participants, in order to properly prepare your certificates, we need for you to place your full name and not just partial names on the chat or on your feed. And we would also like you not to use phone names as well. So it must be the name that we can place on your certificate. And moving right along, we now get straight into it. And I trust you had a great introduction with that, with quizzes. So our speaker for this afternoon is Rona. Bear with me one sec. Challenges with some of the system. Right. Rona Wong Reed. Rona Wong Reed is a certified nurse since 2004 and has been serving the health sector since 2005. She's a graduate of the Kingston School of Nursing, where she studied general nursing. She later earned a certificate in midwifery, a Bachelor's of Science degree in public health nursing with honors, and a diploma in nursing administration with special awards. Since 2005, she has provided dedicated service at Spanish Town Hospital as a staff nurse and to the Kingston and St. Andrew Health Department, first as a specialist nurse and presently as a public health nurse. In addition to her service to Jamaica's health ministry, Nurse Wong Reed has devoted her time to her family, church development, and charitable empowerment. She is married for 19 years and has 2 beautiful girls from this union. She currently serves in the Sunday school and choir ministry at her church and volunteers with Restoring the Broken Ministries Limited since 2022. She is also a course advisory committee member for the Public Health Nursing Program at the University of Technology, Jamaica. Nurse Wong Reed reads wealth of knowledge and almost 2 decades of experience in the nursing fraternity has evolved to her presenting at health fairs, churches, and among her colleagues. She credits all her success, opportunities, and accomplishments to God, and is willing to use her knowledge and experience to provide care and encourage positive change in the lives of others. Let us welcome this afternoon our presenter, Mrs. Rona Wong Reed. Mrs. Reed.
Pleasant afternoon, all. I hope that you are well. Thank you for the introduction. I must give congratulations to the Omega Kappa chapter for this very insightful venture. As the old adage says, an ounce of prevention is worth a pound of cure, but we're not able to do the prevention if we don't have the requisite knowledge. And so this is a wonderful opportunity for us to share and to, get ourselves up to date with what is happening so that we can actually activate that ounce of prevention. So this evening, give me a minute. So this evening, we will be looking at respiratory syncytial virus. Right, and for objectives, we'll be first doing an overview of the virus. We'll look at the causative agents, the epidemiology, transmission, the risk factors, the incubation period, signs and symptoms, diagnosis, treatment, prevention, and we look a little at the immunization concerning this virus. So respiratory syncytial virus is a contagious virus that results in lung and respiratory tract infections. Most children in the United States of America, USA, will become infected with the virus by the time they are 2 years old due to its widespread nature. Adults can also contract the respiratory syncytial virus. The RSV symptoms are minor and usually mimic the common cold in adults and older healthy children. Usually, self-care techniques are sufficient to ease the discomfort. Infants and older adults are more likely to develop severe RSV and will need hospitalization. This virus was first discovered in 1956. The RSV is the leading cause of bronchitis and bronchiolitis among young children and can cause severe illness in select groups such as infants, premature infants, and immunocompromised individuals. The causative agent. So the RSV belongs to the genus Orthopneumovirus family, which includes the human RSV and the bovine RSV. The murine pneumonia virus, which are closely related to measles, mumps viruses. And what I found out is that RSV is not so prevalent in Jamaica because we are vigilant in administering the measles, mumps, and rubella vaccine starting at age 1 year old, which that the USA wasn't practicing for a long time now until they started having outbreaks and they started immunizing their children. So we are credited or we have benefited from that we still have cases, but not as much as they do. Epidemiology. So each year, 4.5 children younger than 4 years acquired RSV infection, and more than 125,000 are hospitalized annually in the US because of this infection. The impact of RSV is not limited to only young children, but in US, it is responsible for 177,000 hospitalizations and 14,000 deaths in the elderly greater than or equal to 65 years of age. Influenza or the flu and RSV usually cause seasonal increases in respiratory illnesses in Jamaica and other countries annually. Weekly visits to public health facilities for influenza-like illnesses have increased in the under 5 years and the 5 to 59 years age categories. Changes in the humidity and the precipitation may affect RSV timing and outbreak. And we can appreciate why US would have so many cases because of their winter season and so on, which we are in a tropical environment. So we tend to, it's obliterated almost because of our climate. Increases in humidity driven by higher temperatures versus dry conditions that drive larger seasonal transmission changes, resulting in cycles becoming more annual and shallower on average. So as the temperature increases, then there is more cases and more seasons of RSV. How is it transmitted? So RSV is contagious and it's spread similar to the common cold through direct person-to-person contact with saliva, mucus, or nasal discharge when kissing, sharing cups, and other forms of close contact. On clean hands, the RSV can survive up to 30 minutes or more on unwashed hands. And we can appreciate how important hand washing is in nursing as one of the most effective way of disease prevention. I'm trying to move the strip ribbon out of my way. Right, so unclean objects or surfaces. The RSV can survive up to 6 hours on surfaces, toys, and keyboards. And so we can appreciate why it is so prevalent in the children that are under 5 years old, because those are the ones who would be playing with toys, sharing toys, and so on. Sorry. So the risk factors is premature infants under 6 months old, low birth weight infants, male infants. And so, you know, when the babies are premature or have low birth weight, their ability to fight and their immune system is at a lower standard than the full-term babies and the babies that are of the regular weight, 2.5 and over. The male infants, it is said that the airway for the males is shorter than the females, so that would be why the males would be more susceptible to this virus. Malnutrition, family history of atopy or asthma, indoor smoking, smoke pollution, maternal smoking, crowded living conditions, and in daycare. Children who are in daycare, those are the children who would be sharing toys and being in close contact with each other. Individuals with compromised immune systems and older adults. The older adults have tend to have a lot of comorbidity, and that as well will affect their immune responses. The incubation period for RSV ranges from 2 to 8 days, but most commonly it's 4 to 6 days from the time of exposure to the time that the person will start exhibiting signs and symptoms. RSV can result in a range of respiratory illnesses and symptoms from mild upper respiratory infections to life-threatening bronchiolitis and pneumonia. So what are the symptoms now? In healthy infants, the RSV usually causes mild cold-like signs and symptoms, including congested or runny nose, dry cough, low-grade fever, sore throat, and mild headache. In the lower respiratory tract, signs usually appear 1 to 3 days after the onset of the runny nose or the rhinorrhea, representing viral spread to the bronchi and bronchioles. In severe cases, though, there is wheezing, difficulty breathing, fever, severe cough, and the baby might also be cyanotic. Healthy adults infected with RSV may have few symptoms, but they can still spread the virus because though they are not symptomatic, they can still spread. And they are usually contagious for 3 to 8 days post recovery or within 1 to 2 weeks. So they're usually contagious for 3 to 8 days and they recover within 1 to 2 weeks. I'm not sure what's happening here. Immunocompromised infants could be contagious for up to 4 weeks post-symptomatic state. So you can imagine these infants not exhibiting symptoms in a daycare for 4 weeks and they are still spreading the virus to others. Oh my gosh. Just a minute. All right, so how do we diagnose RSV? So clinical symptoms of RSV are non-specific and can overlap with viral respiratory infections as well as some bacterial infections. The laboratory tests are available that will confirm the infection. The most commonly used types of RSV clinical laboratory tests are the real-time reverse transcription polymerase chain reaction, or the RPT-PCR, which is more sensitive than culture and antigen testing. The antigen testing, which is sensitive in children, but it is less sensitive in adults. And there are other tests that are less commonly used, such as viral culture, serology, which is usually only used for research and surveillance studies. Some tests can differentiate between RSV subtypes A and B, but the clinical significance of these subtests are not clear. Both the real-time reverse transcriptase polymerase chain reaction and the antigen detection test are effective methods of diagnosing the RSV in infants and young children. Right? The highly sensitive RRT-PCR assays are recommended when testing older children and adults for RSV. The sensitivity of the assays often exceeds the sensitivity of the virus isolation and antigen detection methods. Antigen tests are not sensitive for older children and adults because they may have lower viral loads in their respiratory specimen, right? So their symptoms might not be so pronounced as the younger children, and so they might not be carrying enough of the virus for the test to pick it up, the antigen test. Right. So since November of 2022, the National Public Health Laboratory here in Jamaica commenced preparing samples for testing at CARFO, or the Caribbean Public Health Agency, for PCR testing in order to detect RSV in the Jamaican population. I was reviewing one of the EpiWeeks charts, and what I found was in October of 2023, there were only 17 cases year to date of RSV in Jamaica. So because there was an increase of incidence of children showing up at Bustamante Hospital, Spanish Town Hospital with respiratory symptoms, the Minister of Health then thought it necessary for us to test for RSV, understanding the detriment of it to children under 5 years old. The treatment, as with other viral illnesses like the flu, the goal is to relieve symptoms. The majority of the people heal on their own in a week or less, and those with risk factors, in extreme cases, medical attention will be necessary. How do we prevent it? So, as with similar viral illnesses, the best ways include covering the cough and sneeze, washing hands, can't overemphasize, washing hands often with soap and water for at least 20 seconds, avoiding contact with persons who are not well. Avoid touching the face, especially the eyes, nose, and mouth. And some of these preventions would sound similar because we were hearing them every week between March 2020 and late 2022 because we had the COVID pandemic. Clean touch surfaces frequently, like doorknobs, people going in and out of a room. There's a lot of virus that is left there. Seek medical attention if the cold or flu-like symptoms have persisted or are worsening, and get vaccinated if recommended by the healthcare practitioner. What I found out, I was happy to have been asked to do this presentation because I wasn't so averse with all that was happening with the RSV vaccine. But what I found from preparing for this presentation is that the vaccine is only available for 3 groups of persons: the young children, the older adults, and pregnant women. And we will see the 3 vaccines that are being used. So as was said, the RSV immunizations are recommended for only these 3 groups: adults 60 years and older, pregnant women, infants, and some young children, not all, but some. Right, so in May of 2023, the USA approved the first RSV vaccine for older adults, following decades of failure, because the World Health Organization has stringent principles as it relates to vaccine development, and they were not meeting the standards, so there was a delay in coming up with a vaccine for the older adults. So new vaccines and preventative monoclonal antibodies can help protect babies and adults 60 years and older against RSV. Vaccination of adults aged 60 years and older. This group may receive a single dose of RSV vaccine, and this is usually a decision made by the practitioner and the client. They will decide if this is the best option. Patients' risk of severe disease, their characteristics, the values and preferences, as well as the practitioner's clinical discretion and characteristics of the vaccine are the key considerations here. And so in August 2023, a lot happened in 2023 with RSV vaccine. The Abrysvo was approved for use in pregnancy, and it's the only one that can be used in pregnancy. And the aim is to increase the ability of the mother to ward off the infection, and also to support the unborn child's immune system in preventing the RSV. So 1 dose for the pregnant woman, and this is recommended between 32 and 36 weeks of pregnancy. It is administered immediately before or during the RSV season because it's a seasonal virus. Abrysvo is the only RSV vaccine recommended during pregnancy. So it's only given intramuscularly, and it's a single dose, approximately 0.5 mils. It's a solution for injection, and a single dose after reconstitution is approximately 0.5 mils. If the contraindication is if someone has severe allergic reaction to components of Abrysvo or Abrysvo itself. Right. So there's potential risk, as with all drug, we know, but once the benefits outweighs the risk, then it is considered. Right, and to avoid the risk to the preterm of preterm birth, because that's one of the potential risks to the baby coming before the time. Abrysvo must be used after 32 weeks and not before in order to prevent that unfavorable outcome. Right? It's a Pfizer-made vaccine, and it comes in pre-filled syringes, pre-filled containing sterile water diluent component. So there's a powder and the sterile water component. The vial adapter refer to the manufacturer's packaging insert for, right, so we'll have to check for that. It is stored at +2 to +8, like most of our vaccines. It stores these components in their original package and keep them together in the fridge to optimize their organization, them being stabilized, and they should never be freeze, neither the vaccine nor the diluent. After reconstitution, the vaccine should be administered immediately, and it should not be pulled up and then stored. As with most of our vaccine, public health nurses on the call will know that that's how things are done. Right, so reconstituted vaccines are not refrigerated, right? They are not put back in the fridge. They are taken out and used when they're to be administered. Right, so this is just going over it, but reconstituted vaccine has to be used within 4 hours, otherwise it has to be discarded. The route of administration is intramuscularly via the deltoid region of the upper arm. It is not administered intravenously, intradermally, or subcutaneously. So it's only one dose that is administered, that is recommended for administration, because there's not enough evidence to support giving more than one dose for subsequent pregnancies. There are underlying conditions that may increase the risk of severe RSV illness, and clients most likely to benefit from the vaccines are pertinent to the decision. So the RSV is recommended as a single dose, and studies are ongoing to determine the need for revaccination. Right, so in July 2023, the USA approved the nirsevimab, a long-acting monoclonal antibody for prevention of RSV, lower respiratory tract disease in infants and children aged less than 24 months. So as we were saying, it's young children, but not all young children, those under 24 months. Immunization for infants and young children. There are 2 safe and effective immunizations to prevent RSV, lower respiratory tract infection in infants, as recommended by the CDC. Either a maternal RSV vaccination, so either we administer the Abrysvo to the pregnant woman between 32 to 36 weeks, or the infant is vaccinated. Most infants, they say, will not need both, but there are some who, because of varying situations like immunocompromised state and so on, that may need, the mother might need the vaccine and then the child will need it after birth. Right, so nirsevimab or Beyfortus is a monoclonal antibody product that can protect infants and some young children from severe RSV disease. It is recommended for infants under 8 months old born during or entering their first RSV season, and that speaks to the time in the year that the child is born and when there's a RSV outbreak in the country. And it's typically between the fall and the spring, so between September and February thereabout. If the mother did not receive the RSV vaccine during pregnancy, then, or if the mother received the vaccine and the infant was born less than 14 days after the vaccination, then this child under 8 months would be vaccinated. Nirsevimab can be considered in rare circumstances, even though the mother received the RSV vaccine when, per the clinical judgment of the healthcare provider, the potential incremental benefit of administration is warranted. So depending on what's happening to the child, the risk at play, then that would determine the need for vaccination of the child post vaccination of the mother in pregnancy. Pregnant women who may not mount an adequate immune response to vaccination, like persons with immunocompromising conditions or have conditions associated with reduced transplacental antibody transfer, like persons who are living with HIV, then they would have to vaccinate the child again as well, because mother would not have mounted enough antibody to transfer to the child. Some children between the age of 8 and 19 months who are at high risk of severe RSV disease before their second RSV season, and these include children who have chronic lung disease of prematurity who require medical support, like those who are on steroids, diuretic or supplemental oxygen, or at any time during the RSV season. Children who are severely immunocompromised, children with cystic fibrosis who have severe disease, if they're American, Indian, or Alaska Native children, then they are required to get the vaccine again between 8 and 19 months because they are more at risk for the RSV. The Nirsevimab is administered by intramuscular injection. It is long-acting. It provides protection for at least 5 months, the average length of 1 season. So we'd see why those that are at high risk would need another dose in the second season, because that initial vaccination would only last for 5 months. Only 1 dose is recommended for an RSV season, so there's 1 dose during the season. However, immune protection will wane over time, so they are not protected for life at all. But then, as we have seen, it's those that are under 24 months that are more susceptible to this virus. Another monoclonal antibody, palivizumab or Synagis, is recommended by the American Academy of Pediatrics for administration to infants and young children who are at increased risk of severe RSV disease based on their gestational age and certain underlying medical conditions. This now, though, is a monthly intramuscular injection that is given during the RSV season, based on what is happening with the infants in terms of their comorbid state. All right, so today we looked at the RSV, or the respiratory syncytial virus, which is a virus that causes infection of the lungs and the respiratory tract. We see where it resembles closely the flu, outside of the fact that the flu is more contagious because you're exposed to somebody one day and by the next day you start coming down with signs and symptoms. The average incubation period for the RSV is 4 to 6 days. We see where the treatment is basically treating the symptoms, their antigen test, as well as the PCR test that will determine if one is infected with this virus. And also, there are means to protect or lower the risk of two specific groups, because it's really the children while the mothers are being vaccinated and the older adults from getting the virus. I hope that you've garnered information from this. You've learned something new that you didn't know before. I certainly did learn while preparing to come to you. At this point, I'm not sure if there are any questions, but it's question time.
Okay, so if you all have any questions, both on the YouTube forum and on this platform, now is the time to ask those questions.
I see a hand raised. Marlie's hand is up.
Go ahead, Marlies. I'm not seeing it though.
Okay, I saw it on my end. I'm not sure if it's a new hand or it was there before. Kimari's hand is also up. There are two hands up. I'm not sure if they are current.
Well, my hand is current, may I?
Yes, you
Sure.
may.
All right. I want to thank you so much for your presentation. It was very informative. I didn't hear about RSV until last year when the US had their outbreak. What stood out to me was how long the virus can stay on surfaces. I think you said up to 6 hours.
Yes, on the toys and so.
Right. So
30 minutes on hands. It's very contagious.
it really drove home to me the importance of how we maintain the cleanliness of our environment, both in the childcare setting and in the hospital setting, how we're using or how the janitors are using the various cleaning solutions. So that really struck home to me. Question though, another very shocking fact was how long someone who has recovered remains contagious,
Contagious.
right? So my question then is, I think you said up to 4 weeks. Yes?
Yes. Yeah, persons who are immunocompromised.
Right. So my question is in relation to the children who are in daycare. Let's say one of the children is infected. Is it standard for that child to be asked to remain out of daycare until um, 4 weeks have elapsed? How soon can they go back to daycare given how contagious this is and how long they can remain contagious?
Right. All right. So very interesting question. I like that question very much. One of the things that will be important here is if the person was actually tested for RSV. For example, in our country, this is not something that we do routinely, right? Because as we said, that the prevalence rate is not so much here like it is in the USA. So if we're somewhere like that where the prevalence is so high, then the child would have been tested, and having this knowledge that the child can continue to be contagious post symptoms, then certainly this child will have to stay out of daycare.
Wow, just a follow-up reaction to that. I'm thinking, I suspected as much that it would more apply to the United States.
Right.
And I thought about how inaccessible home childcare is, thinking about the finances associated a lot. Let me tell you, very, very thought-provoking presentation. Lots
Yeah.
of things to think about. I thank you so much.
Yes, thank you too. I think too one of the things that we can do is get this information out to these persons. As you when you started to ask the question, you did speak about how important it is for us to keep the environment clean. So as public health officers, we have to ensure that we're out there and we're giving the information, and we are also monitoring to ensure that persons are doing what is required of them. Marlies, your hand is for this time.
Yes, it is. Good evening, everyone.
Right.
Mrs. Wong Reed, I found your presentation very well researched, and I'm glad for the knowledge because although I'd heard about it, I didn't really have a lot of information. And nearing the end of your presentation, I heard something about, I think you said, correct me if I'm wrong, you spoke about two sets of persons who are more likely to get it in the US. I think you said something about the
elderly and the young children.
no, I think you said something about Native American Indian, or I'm not
Right,
sure.
right. A lot of persons who live in Alaska, Indian and Americans, yes.
So I'm just curious as to why those
I
persons are
think,
more likely. Is it
right,
they?
so we did speak about the humid environments. So I believe it is
Yes.
attributed to that because Alaska is very cold, and with
Okay.
India, I think too there are some in terms of the risk of overcrowding and stuff like that in some parts of that country. I'm sorry, I
Oh,
didn't pinpoint the reason, but I'm just matching it back based on the presenting, how the disease presents and what causes it and so on.
okay. All right, thanks. I didn't really hear that part very well. That's why I wanted the
Okay,
clarity. Right.
no
Thank you
problem.
very much.
You're
Okay.
welcome.
Any more questions? Kimari, I'm seeing your hand up.
Oh no,
She
old
did
hat.
she did speak, yeah. She was the first to
Yeah,
engage.
I thought she had another question.
Okay.
Anybody else? So while we are waiting for persons to ask questions, I have a question for you all, or probably two. And you can type your answers in the chat or on the YouTube platform. So repetition, as they say, breeds learning. And we would have said it a couple times well. So what does RSV stand for? See, easy question. Are we seeing any typing? You all can speak as well if you don't want to type. Anything yet?
I have typed it, Marlies.
Elise? I don't know why I'm not seeing some of the things, Jill. So I feel, all right, I'm seeing 3 messages here. Ah, okay. Thanks, Andrea. And, oh my goodness, where did it go? It's Andrea and Melise. Thank you. Quite correct. Melise was first. Melise is taking her first place. Yes, Melise. Okay, so the other question I have to ask you all, how long does RSV last? Ah, great. So Melise is ahead again, and Andrea. So this is great. And the last thing I have is the vaccine, once reconstituted, must be used within how many hours? Yes, LaShawn Brown. Hope I pronounced it correct. Right. So great. Thank you all for that, your responses. Miss Rona Wong Reed, learning definitely has taken place here at this forum.
Yes.
So
I
anybody
hear
else?
a question
Any
from
questions?
YouTube. I'm not sure if it was asked.
No, it was not asked.
Okay.
Thank you, Rona. I'm doing the YouTube monitoring to bring it over. So the question on YouTube is, why are the immunocompromised persons not in the group of people who are targeted for vaccination or immunization against the RSV?
Aren't they the ones that would get it if though the mother got it, then the immunocompromised ones, they are, man. Maybe that person missed it, but we did say so.
All right. So immunocompromised persons are among those who are targeted to receive the vaccine.
Right, yes.
All right. And then I had a question I typed in the chat earlier. Know that you are sharing with us, because like other persons, we are now recognizing that though we are tropical and may have some kind of protection based on our climate from RSV, it is here. It's probably other places in the Caribbean too. Are the vaccines, do we know if they are here in Jamaica or anywhere else in the Caribbean? Any of
No,
them?
no, I don't know of it. I did research intensely, but the only thing I found, I know we don't have it in the public health system, but sometimes private persons do have. But one of the things that I found, and I did say it at the beginning, was because we use MMR at age 1, we get some protection because the causative agent is from that family.
All
But
right. And
but the fact that just since 2022 we started doing testing for RSV, then anything is possible in our setting because we do have cases.
all right. So that leads me to the last question I had, because I was listening to you as well. I'd say like my colleagues, I'm thinking 6 hours on a surface and we have to pay extra attention. It's respiratory. I have asthma, all the respiratory things affect me, and I'm pretty sure I've had RSV. I'm not sure, nurses make bad patients. That's what they say, right? So I'm not sure I want another vaccine, but I'm asking, apart from pregnant mothers to help to protect the infant or the unborn child, are these vaccines, I may have missed it, any one that has been approved just for adults who may choose to have such a vaccine in the RSV season, like the way we have the flu vaccine every year?
No, just the older adults because how it presents, the symptoms for regular healthy adults is not it doesn't affect them as badly as it does the older people and the younger children. So there's none at present.
All right. So if we're in the middle-aged group and we are diagnosed with RSV, it's pretty much managing the symptoms.
Yes.
Okay. All right. Thank you.
Welcome.
Just one question for Miss Wong Reed. Just a thought though. For some persons who would have indicated that this is the first time they are hearing about RSV, I myself. So is it possible that this is something that can be under diagnosed or underreported, seeing that it represents so closely the common cold, the flu?
Yes, definitely. It can be. And if we're not, as we recently started testing, and I'm not sure, I know, all right, so we have influenza-like illnesses. It includes SARI, the flu, RSV itself, H1N1, COVID as well. And so sometimes there are some sentinel sites that we have in Kingston and St. Andrew that we test 1 in 10 samples. So for every 10 child that presented, then we would test the 10th one. So we're not testing as vigilant. So yes, it is, especially too, if the child was not presenting with severe symptoms, you could have missed it.
Okay, thank you. So if no one else has any
Just one more comment.
questions.
I think what we do here too is reactive. So if we see the A&E at Bustamante filling up with a lot of influenza-like illnesses, then we will tend to say, okay, let's test to see what is happening here, because we're comparing with another epi week to say it's more now in this season. I know we live in a global village, people traveling back and forth and so on. So I think we're mostly reactive in that regard.
Okay. So I know this information was well received, and I thank you, Ms. Wong Reed, for sharing that information. And at this point, we are handing over again to our president, who has another activity for you all before we conclude this evening's proceeding. So over
Thank you
to
so
you.
much, Madam Moderator. I do have one last question from YouTube. I was going back and forth. I'm just double checking. from the YouTube perspective, they're asking if the RSV is also one of the notifiable diseases.
Yes, it is.
Okay. All right. So we had a few people who joined us after we started. And if you missed it, so what happened? Let me start at the beginning. We were supposed to have two persons this afternoon, and we only have one through no fault of ours or the presenter, unfortunately. So let me start and say that we apologize for that. We were hoping the other person would have been able to join us by the time Mrs. Wong Reed was complete, but it is not so. However, since it's no fault of yours either, even though we will more than likely be finished early, it will still be that the CE hours for today are 2.5, as promised. So with that being said, I also wanted to say to you that for those of you who missed it at the beginning, we are the Omega Kappa chapter of Sigma Theta Tau International Honor Society of Nursing. Sigma Theta Tau International Honor Society of Nursing is quite long, and we just call ourselves Sigma. And what we usually do, this is our 4th webinar series. At the end, we try to just give a quick overview of who we are. So we know you've seen us, you saw the flyer, you've joined the sessions, but just in case you were wondering, we just wanted to share a little bit with you. So I'm going to go ahead and do that. And I had one closing activity. I will ask people to put their raise hands in the chat if they so wish to participate. We had a little quiz at the beginning, and our winner, it was Miss Sandra Morris. Mrs. Sandra Morris is a member of Omega Kappa, and we are glad she participated, but perhaps we want a non-chapter member to win a little prize, right? So I am the president of this awesome award-winning chapter. We are 4 years old. We're heading to year 5 in May, and we are chapter 560. Geographically, we are in Jamaica, but our membership is global, and we have members across the Caribbean. Trinidad and Tobago, our moderator Kathy is in Trinidad. We have members in Barbados. We have members in St. Lucia, Antigua, the Commonwealth of the Bahamas. We have members in the US, in the UK. So we are just one of the chapters of Sigma International, and Sigma is an organization of nursing students and nursing leaders. There are over 540 active chapters. We have over 135,000 members, and our chapter has won 2 regional prizes and awards in our 4-year lifespan, and we've also won 2 of Sigma's international awards recognizing the excellence we've been doing in nursing leadership, scholarship, and service. That's what Sigma is about. And so we are happy to be able to share a little bit of who we are with you. So we have a YouTube channel, which we are live streaming to as we do all our educational sessions. There are, in fact, over 30 sessions on that channel, including all the ones from the previous webinar series and the other educational ones we've had. We are also on Facebook. We are on Instagram. We are on Twitter. All of them would say Omega Kappa chapter. So you could find us and follow us to get those updates. And if you want to know a little bit more about what we're doing, then you could also just send us an email, the same one you used to register, because we are in the UE School of Nursing, Mona, and we are building up nursing leaders, starting with our students. We are encouraging people to be involved in scholarship, to be academically pursuing excellence, and also in service. So we continue to give back. And so we just wanted to let you know a little bit about who we are. So we do have members who are in today who have joined the session. We do need to pay our membership to Sigma International. And so, for instance, one of the benefits for the persons who are chapter members today is they don't need to pay for the session that we're putting on. So there are different things that we also do as well, and we are working on increasing our presence across the Caribbean region as we continue to grow as a chapter. And I would say before Kathy Ann, who was moderating, or Heather, who is our treasurer and fundraising committee chair, jumps in to put it, or any of our members in the chat, I'd also like to share that we are a part of the Latin America and Caribbean region. And so there are 5 chapters, one in Jamaica, one in Chile, one in Brazil, one in Colombia, and one in Mexico. And having served as the president for the last 4 years, I'm outgoing. I have also been recently elected as the coordinator of the Latin America and Caribbean region. So we just want to say that we are over here trying to do all the things that we can do to help to do our part in living up to Sigma's mission and vision, which is to empower our nurse leaders everywhere to impact healthcare everywhere. So we want to thank you really and truly for joining our sessions. Take something away to use. Join us all the other evenings. Tomorrow evening, we are going to be looking at port health or border control. Ever wonder why you get those vaccines, but they don't ask you when you're leaving? It's only when you're coming back, you may have to join a different line. And also, the other topic we'll be talking tomorrow about climate change. Very topical. Across the Caribbean, we had the hottest summer ever, which we are being told may be the coolest one in years to come. But how does that impact on the infectious diseases? So that's what we're going to be talking about tomorrow. So just if you have any questions, remember, email us or reach out to any of us. And we want to thank everybody who was here with us today. But the last activity. So I need you to tell me if you want to open your mics or you want to put it in the chat. Do you want us to do the last quiz I had for you on the same platform of quizzes? Or do you want me to just throw out the questions I had written down and then we will take the answers in the chat here or over on YouTube? So let me hear, what's your preference? I'm not hearing a soul. Nobody's talking to me.
To throw them out.
All right, so you want me to just throw the questions out here. Nobody wants to do another quizzes? Not the same one. That's two people. All right. Somebody wants the quizzes. Somebody wants to just throw them out in the chat. Anybody else? There are approximately 40 of us in here except me. Go ahead, Andrea.
You're asking us to raise hands for quizzes.
Oh, so you're raising your hand. All right. All right, anybody else? Let's go quickly because you are going to get to go home early or log off today. In truth and in fact, because we are a regional and a global chapter, we always use the online platform, but I know plenty of us out of COVID sometimes are platformed out. So anybody else quickly? Quizzes or throw the questions out. The questions won't be the same, but who's ready? It's just another one for epidemiology to remind us that we need to just ensure we are keeping ourselves a little bit up to date so we can practice and give of our best, whether we are in the clinical space, educational space, or the research space. All right, so at this point, I have two people for throwing it out and I have two people for quizzes. Anybody else to break the tie? I like when the persons speak to me, For teacher, silence is not a good thing at all. All right. I came over to YouTube to check, and somebody over here, Shani, saying, let's just throw them out. So we're going to go ahead with that. All right. So everybody's ready for the throwing out now? So the instructions are, I will give the questions. You're going to make note of what the questions are, and we need all the answers at the same time in the chat. I'm going to ask Kathy Ann and Heather to help me to see. So I'll be checking over YouTube and I'm going to be asking for them to look over here on Zoom. We want one answer, one response with all the answers. The first person who does that is the person who will have one. So everybody's ready? I'm going to say the questions and then you are going to pay attention to what the questions are. And then you are going to go ahead and type your response. So it's 5 questions. So you have to listen out for that. Are we all ready? Hands, mouths, everybody ready? Hold on. So you are ready and I am not ready. Where are my questions? All right, give me 1 second. The joys of technology. The joys of technology. And I had this one all ready for you because I made a note of the general questions that we're going to ask, and it will include one single one from the presentation. Please just give me 1 second to ensure I'm not giving you the wrong questions. All right, everybody's ready? So question number 1. I'm asking one question from the presentation, and that first question is, there is one vaccine that was shared that was recommended for pregnant women. At what stage of pregnancy was the vaccine recommended to be given to the pregnant woman? All right. The second question just requires a little explaining. So the second question is, what is an endemic? You got some of these in the first one, just phrasing a different way. Third question, what is a pathogen? Question 4 looks at, that one went right through my head again. All right, so let me change question 5 to question 4. Question 5 came from the presentation as well. At what stage did Mrs. Wangwit say that we started doing the testing in Jamaica for RSV? She gave us a date. When was that? And then the last one is something that was shared with us, but we should all know, and this one requires another little bit of explaining, what is the importance of hand washing in infection prevention. So that's 5 questions. Let me repeat them so that everybody can go ahead and type in the chat, because I know you're raring to go. Remember, you type all the answers at once. Question 1. We were told that there's a particular RSV vaccine that's given to the pregnant mother. What stage of pregnancy is it recommended to be given? Question 2, what is an endemic? Question 3 asks us, what is a pathogen? Question 4 from the presentation today, what date was shared with us that they started doing testing in Jamaica for RSV? And the last one is the basic of things that they say is the most important thing that we should all know as healthcare providers. What is the importance of hand washing in infection prevention and control? So go ahead with start typing. We're gonna be looking. All right. While they're checking over here, let me go check over YouTube because they will be a little bit behind. How are we looking over there, Kathy Ann? Anybody typing in the chat? And are the answers correct?
Yes, they are.
All right, good job. Just waiting over on YouTube because we know they're a little delayed, so they're probably trying to type as we speak. All right, so while we're waiting over YouTube, Madam Moderator, so you find out, you can tell us who is the first person who has all the answers correct over there, so
I'm
we can
seeing
figure out who's getting our prize.
I'm seeing Janelle. So, but then I'm not seeing this one. I'm seeing Janelle. I'm trying to see where is this. I can't make out the city.
All right. Janelle Messam.
Yes.
All right. So Janelle was first. Janelle
She has
shot out
30.
of those blocks like Shelley and Fraser Price.
Yeah. And I think the fifth. Where is the fifth? Where is the fifth?
All right. So she said 32 to 36 weeks, and endemic is a disease to a small geographic area. Pathogen is a causative agent. March 2020 is what she says. Prevents the transfer of pathogens. That's what the hand washing does. I'm going to ask everybody to verify if this is correct because I'm not sure they're all correct. All right. Then Lashana responded. Second. So Lashana says 32 to 36 weeks. A disease regular occurring in an area community. A microorganism that causes diseases was the pathogen. Number 4, it's 2022. And number 5, hand washing helps to prevent the transmission of microorganisms. So I'm asking because as far as I can recall, she said we started testing in 2022. So that would mean that though Janelle responded first, Lashana has the first 5 correct answers because Janelle says March 2020. All right. So, Lashana, thank you everybody for participating. The answers are still coming, but based on, we're going with the first person with the 5 correct answers. Then Lashana Brown, it would appear, is our winner. Lashana, we're asking you to just email us to the same place you sent the email so we can have contact for you, so we can arrange your prize. We have to figure out how do we get it to you depending on if it's something that's tangible or we need to make it intangible. So I will check over on YouTube one last time and I will hand over to our moderator so she can officially say thanks and close out our session for today. We do apologize again for the fact that we are short one presenter, but we will not have your CE hours short. It will still be 2.5 hours for today. And then we begin again promptly tomorrow at 4:30 p.m. for port health and climate change and infectious diseases. Over to you, Madam Kathy Ann.
Thank you, Cheryl. Well, everyone, we have come to the end of this segment of our 4th IPC's webinar series. We want to say thanks to all the participants for taking time out to come and update themselves. And I trust that you all would have learned something this afternoon. I know I certainly have, because every day we learn something new, and learning is always ongoing. And, you know, you need to look at some of the take-home messages that we would have garnered from the 2 activities that you participated in so that we can keep updating ourselves and monitoring our IPC practices. Once again, I want to say thanks to Ms. Wong Reed for taking her time out to come and share her knowledge with us. And without further ado, thank you all. Have a blessed evening. Get to your home safely.
Thank you, everybody. Have a good evening. See you tomorrow.